Silent swelling of the belly can hide serious health issues that are easy to miss until they become critical. Discover the subtle signs to watch for 10 common problems, why early diagnosis is crucial, and how accessible tests like ultrasound can make all the difference. Atoshi cooked for 24 guests effortlessly, yet she carried a 23-kilo tumor. Sanghamitra, the fashion-conscious singer, had a uterus grown nearly 18 inches. Mrs. Blackburn, 57, on the other hand, from Manchester, discovered she was silently pregnant. After 25 years as a gynecologist, one truth is crystal clear. The belly swells silently, very slowly, and quietly. And that's exactly why we miss it. Part 1. 3 traps that hide the truth. Trap 1. The slow motion problem. When your belly starts swelling, change happens so gradually, your brain doesn't register it. You look in the mirror daily, yet never notice your face has transformed. The belly works identically. Here is the deeper issue. Our bodies adapt to slow changes without complaint. When something shifts millimeter by millimeter over months, we don't recognize it as a symptom. We call it normal and move on. That's precisely why problems grow unchecked. Trap 2. The wardrobe doesn't warn. Men have an accidental early warning system. Tight trousers signal belly expansion immediately. Women, saris, skirts, and petticoats stretch endlessly without complaint. No fixed waistband sounds the alarm. Has anyone ever said, "My sari feels too tight"? Never. Kurtas might tighten occasionally, but salwar bottoms cut loose by design. Only women regularly wearing fitted jeans detect change. Most women's wardrobe offers no feedback, so the belly expands invisibly. Diagnosis gets delayed while expansion continues unchecked. Trap 3. Waiting for a second symptoms. These catches nearly everyone. We instinctively expect serious problems to announce themselves loudly with multiple signals simultaneously. So when the belly swells, you wait for backup warnings. We think if something is genuinely wrong, I'll have pain or irregular periods or digestive trouble or urinary issues. When those additional symptoms don't appear, we conclude everything is fine. The single symptom gets dismissed as nothing important. Remember Atoshira? Even after removing her 23-kilo tumor, she couldn't believe it had been there. She expected pain, bloating after meals, difficulty in eating, but none arrived. The tumor grew in complete silence. Women often expect period problems, gas issues, eating difficulties, or bowel trouble. Yet, most abdominal swelling happens entirely alone. No companion symptoms at all. The lesson: when doubts appear, don't wait for a second symptom. Get checked immediately. Part 2. How diagnosis works. Why belly diagnosis is challenging? In medical school, professors asked, how do you diagnose this? We recited the textbook answer confidently. Take good history, perform clinical examination, order investigations like ultrasound or blood tests, interpret results, blah, blah. But here is the enormous missing piece. None of it starts until patients walk through the door. The actual first step: the patients must notice something feels wrong and decide to seek help. Without that initial awareness, even a watermelon-sized tumor remains completely undetected. Medical colleges never taught this to doctors. Normal schools never taught people around us body awareness or health literacy. Yet, it's most critical step in the entire diagnostic chain. Your body belongs to you. Your health is your responsibility. Learning to notice changes isn't optional, it is foundational. When to investigate? The moment you suspect belly swelling, consult your doctor. Doctors are human, not magicians. Not everything shows on examination alone. Eyes and hands have limits. That's why ultrasound enters, your reliable starting point when suspicion arises. Here is an honest truth though. Of the top 10 causes of belly swelling, ultrasound cannot perfectly diagnose 8 of them. But the 2 it catches, those discoveries save countless lives. The choice of tests in medical science does not chase only accuracy. The choice of tests weigh accessibility and affordability too. A test that costs a fortune or requires specialist centers isn't practical always. Ultrasound strikes the right balance: simple, widely available, inexpensive, and genuinely informative for several critical conditions. So, ultrasound first. Still, even when ultrasound returns normal, don't assume everything is perfect. Normal simply means nothing obvious appearing on that particular scan. It doesn't mean everything is truly normal. What ultrasound excels at? Tumors. Whether in ovary, uterus, livers, ultrasound typically reveals them clearly and early. Pregnancy detection is nearly flawless, even in unusual cases. Fluid accumulation: when liquid collects in the abdomen, that means ascites, ultrasound picks it up reliably. These three categories alone make ultrasound invaluable at first-line investigation. Sometimes ultrasound provides immediate answers. Often it raises questions needing deeper investigation. If ultrasound detects an ovarian mass, is it simple, complex, benign, or potentially malignant? Finer distinctions require CT scans, detailed cross-sectional organ images, sometimes MRI, excellent soft tissue characterization, or maybe PET-CT, metabolic and anatomical information, useful for cancer staging. Endoscopy, direct visualization of digestive tract through various holes of our body. Blood tests, tumor markers, hormone levels, inflammatory markers only become positive if the problem spills it into the blood. Medicine follows stepwise diagnosis. Start broad, narrow systematically. Each test answers specific questions, guiding the next decision. Even with all the technology, sometimes the breakthrough comes simply from listening carefully to what patient says. Medical history, that means what patients tell us in person, remains irreplaceable. Patterns emerge that scans cannot reveal. It is essential to talk to patients adequately. Part 3. The 10 real causes. Based on US National Institutes of Health Research and global peer-reviewed studies, here are 10 most common causes of abdominal swelling in women. Pregnancy is excluded because its diagnosis is relatively straightforward. Number 1. Gas and bloating. Gas forms when food moves slowly through the tract. Rich meals take longer to break down. Stress makes you swallow excess air. Intestines occasionally slow temporarily. High fiber diets also produce gas. Here is the crucial warning: do not stop eating fibers. Yes, fibers causes gas, but understand what you would lose. Fiber prevents diabetes by regulating blood sugar, fights chronic inflammation throughout your body, reduces colorectal cancer risks rather significantly, strengthens immune system. Don't abandon a true friend for temporary discomfort. Recognize and appreciate fiber's value. Gas is a small price for the protection it offers. Number 2. Irritable bowel syndrome. Your intestine stretches roughly 9 meters. Imagine 30 feet of tubing coiled inside, each section with its own personality. Your gut contains 200 to 600 million nerve endings, your second brain operating with surprising independence. Sometimes this enteric nervous system gets irritable, overreacting to normal stimuli. One day it bloats dramatically, next day urgent diarrhea, then sudden severe constipation. Certain foods trigger disproportionate reactions. IBS is a diagnosis of exclusion. Its symptoms mask serious conditions like inflammatory bowel disease, celiac disease, even early cancers. Proper diagnosis must come from a qualified gastroenterologist, not by self-diagnosis. Number 3. Food intolerance. Some foods refuse to cooperate with certain digestive systems. Scientific villains belong to FODMAP group. That means fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Certain sugars and carbohydrates that ferment inside your intestines, producing excessive gas. FODMAP includes wheat and wheat products, onion, garlic, shallot, dietary products, apples, mangoes, watermelons, stone fruits, cauliflower, mushrooms, beans. The gas these produce is entirely normal, but knowing what causes gas helps a lot, isn't it? The milk problem, important. Many mothers feed extra milk to bulk up the children, unaware cow's milk evolved for cows, not human children. High lactose cow's milk causes digestive upset in children expecting human milk. Lactose intolerance is extraordinarily common. North India, 1 in 3 people cannot digest lactose. South India, 3 out of 4 people cannot digest lactose. If milk causes problem, try curd or paneer. Fermentation breaks down lactose, making them far more digestible. Beyond lactose, fructose such as apples, mangoes, grapes, and polyols which is contained in stone fruits, also irritate certain digestive systems. Some people's bellies swell from apples, others from mangoes, others avoid grapes entirely. All FODMAPs doing. Food intolerance won't show on ultrasound or standard blood test. Diagnosis requires careful observation, detailed food diaries, and sometimes systematic elimination diets supervised by specialists. Number 4. Constipation. Hard stool traps gas. The intestines distend. The belly swells visibly. Constipation rarely appears on ultrasound scans. Radiologists might note fecal bloating, but diagnosis comes from patient history and examination. Complex cases require CT scans revealing intestinal backup extent. SIBO, or small intestinal bacteria overgrowth, or SIBO. Your colon houses trillions of beneficial bacteria, an ecosystem essential for health. These bacteria belong in the large intestine, where they break down fiber and produce vital nutrients. Problems arise when bacteria migrate upwards into small intestine, which should remain relatively pristine and sterile. Good bacteria disappear, enemy bacteria take over. SIBO develops. Chronic bloating worsens after eating. Unexplained abdominal pain alternating diarrhea and constipation symptoms mimicking IBS but unresponsive to standard treatment. SIBO hides brilliantly, invisible on ultrasound and CT scans and normal blood tests. Missed initially by gastroenterologists diagnosing IBS instead. Confirmation requires specialized breath testing or small bowel aspiration. Not easy to do. Many patients struggle for years before correcting diagnosis because SIBO flies under the diagnostic radar. Number 6. Abdominal fat. We have survived centuries of famine. When delicious food becomes available, celebration seems natural. We eat joyfully. The belly expands gradually, almost unnoticed. Society celebrates it. Look how prosperous you have become. But that expanding waistline brings many unwelcome companions. Type 2 diabetes, hypertension, fatty liver disease, cardiovascular disease, sleep apnea, increased cancer risks. Never assume a growing belly is simply happy weight gain without investigation. Get one baseline ultrasound at least. Number 7. Ascites. Fluid in the abdomen. Sometimes the belly swells because fluid accumulates inside the abdominal cavity or surrounding organs. This condition, ascites, has several causes. Liver disease. Cirrhosis creates pressure forcing fluid from blood vessels. Heart failure, where heart cannot pump effectively, fluid backs up throughout the body. Kidney disease. Failing kidneys cannot regulate fluid balance properly. Cancer, particularly ovarian, uterine, or gastrointestinal cancer, trigger fluid accumulation. Infections, tuberculosis affecting the abdominal cavity, peritoneal TB remains surprisingly common. Ascites appears clearly on ultrasound. The radiologist describes free fluid in the abdomen and estimates its volume, but identifying fluid is just step 1. Understanding why it is there requires thorough investigation. Diagnosis demands urgency because ascites always signals a significant underlying problem. 8. PMS or Pre-Menstrual Syndrome. Hormonal fluctuations in the few days preceding menstruation cause widespread problems. Estrogen and progesterone levels shift, triggering fluid retention, breast tenderness, mood changes, abdominal bloating, heartburns, and so on. The belly feels generally swollen and tight during this phase. Distension typically resolves completely once menstrual bleeding begins as hormone level stabilizes. If the bloating persists throughout the cycle rather than following this predictable pattern, investigate further. Number 9. Gastroparesis or functional dyspepsia. Gastroparesis means stomach paralysis. Though the organ doesn't actually stop, it just becomes sluggish. Normally, your stomach acts like a muscular pump. Food enters, gets churned with acid and enzymes, then pushes systematically into small intestine. This process runs smoothly. In gastroparesis, that pump loses coordination. Food arrives but lingers in the stomach far longer than normal. Hours pass, the stomach distends, gas forms from bacterial fermentation of stagnant food. Some gas travels upward, causing belching and reflux. The rest moves downward into intestines, creating uncomfortable bloating and distension. Common causes include diabetes, damaging the vagus nerve, certain medications, autoimmune conditions, or sometimes no identifiable cause at all. Number 10. Hidden tumors. This is the diagnosis we absolutely cannot afford to miss. Tumors growing silently in the pelvis or abdomen can reach astonishing size before causing symptoms. Tumor does not automatically mean cancer. A tumor is simply an abnormal growth, a mass where one should not exist. Many tumors are essentially benign, but they still cause problems through size and position. Uterine fibroids. These benign muscular growths transform a normal fist-sized uterus into an organ weighing several kilograms. I have removed fibroids larger than footballs. The patient knew her belly had grown but assumed it was weight gain. Fibroids often produce gynecological symptoms, heavy periods, pelvic pressure, frequent urination, but not always. Sometimes they grow silently, announcing themselves only through abdominal enlargement. Ovarian masses next. Here is where silence becomes truly dangerous. Ovaries sit deep in the pelvis with plenty of room to expand before causing symptoms. An ovarian cyst or tumor can grow to extraordinary proportions without producing pain or bleeding. Unlike uterine problems, ovarian issues rarely send clear gynecological signals. They operate in stealth mode. That's precisely why making them so concerning. Women say, "But I feel fine. How could there be a tumor?" That's exactly the point. Ovarian masses are the quiet ones. They are the problems that don't announce themselves. And you know what they say, it's the quiet ones you need to watch. Why this matters. Early detection transforms outcomes. A small ovarian cyst might need only observation or simple surgery, but the time it's filled the abdomen, surgery becomes complex and riskier. If malignancy develops, early stage offer cure rates above 90%, but in late stages, survival drops dramatically. A basic ultrasound catches most problems. Simple, affordable, accessible, yet life-saving. Don't delay investigation when your belly feels somewhat different. The cost of one scan is negligible compared to misdiagnosis. Important? Emergency warning. Everything discussed relates to gradual progressive belly swelling developing over weeks or months. This article does not cover something called bowel obstruction. If you experience sudden severe abdominal distension with complete inability to pass stool or gas, severe cramping, vomiting, or abdominal rigidity, you may have bowel obstruction, a genuine surgical emergency. Don't read articles, don't wait for appointments, go straight to hospital emergency immediately. But most of you will not have bowel obstruction. It is pretty uncommon. For you, this out of syllabus article will help immensely. Your belly speaks softly, learn to listen. That's all today. See you soon with another research article.